Hi everyone, this is Dr. Anitha G, your Microbiology NEET PG faculty in DG now. So today we'll be discussing INI-CET November Microbiology 2025 question. So this time you have got some 15 to 18 questions from microbiology, and most of these questions were from previous year question paper, and approximately some 10 to 13 questions were straightforward question. So going into the first question. What is the most frequent cause of viral diarrhea in adult? This is a very straightforward question, and the answer is norovirus or norovirus. If at all the question was like, what is the most frequent cause of viral diarrhea in children, then the answer would have been rotavirus. Even this adenovirus 40 to 41, this also causes infantile gastroenteritis. And astrovirus is also another agent known to cause diarrhea in children. Okay, so out of the option given, the most frequent cause will be norovirus. Second question, identify the organism responsible for this condition. So they have circled. They have circled it here. They have asked what is the organism responsible for this condition. So what is this picture actually? This is nothing but germ tube test. Okay, nothing but germ tube test. So this is ideally done to identify whether the given organism is Candida albicans or not. So how to do this test is you take a serum sample and you mix it with the Candida that you want to identify. If at all it is Candida albicans or Candida dubliensis, then this yeast cell will produce a tube like this. So this is called as germ tube. Okay. So two yeast which produce germ tube are Candida albicans and Candida dubliensis. So here they have given a circle in which they have shown a germ tube formation. So out of these option mentioned, it is Candida albicans. Candida albicans is the correct answer. Third question, which of the following infections can be acquired through a thorn pick? Okay, so the examples what they have given is dermatophytosis, chromoblastomycosis, mycetoma, and sporothrix. The question actually here is which of the following infection cannot be acquired through thorn pick? I think this is the question that was asked in your exam. So as soon as you see the question, you should not jump to sporothrix. You have to read the question properly. The question given was, which of the following infection cannot be acquired through thorn pick? So if you see, means all the agents causing subcutaneous mycosis can be acquired through thorn pick. That is sporotrichiosis, chromoblastomycosis, and mycetoma. All these causes subcutaneous mycosis. So all these infection can be acquired through thorn pick. So the exception here is dermatophytosis, which usually acquires through close contact with the human being, or it can be acquired from animal or from the soil. Okay, so the question here is which of the following infection cannot be acquired through thorn pick? The answer is dermatophytosis. All other thing causing subcutaneous mycosis, that is chromoblastomycosis, mycetoma, and sporotrichiosis, all these can be acquired through thorn pick. Next question. A patient presents with chronic cough and hemoptysis. Chest X-ray shows ring-shaped opacity in the lung field. CT scan reveals cystic lesion. Sputum's examination shows the following finding. Which of the following is the drug of choice for this condition? Okay, so here patient is presenting with some pulmonary manifestation. First point, patient is having some pulmonary manifestation. And he is having Blood in sputum. Hemoptysis is also present. This is the first hint given. Second hint is sputum examination shows the following picture. If at all you see here means you are able to see an opening. Okay. So these are nothing but operculated egg. These are nothing but operculated eggs. So where are operculated eggs seen? So we have discussed a mnemonic is STD in spirometra, in trematodes infection, and in diphyllobothriosis. So here the question is very straightforward. Chronic cough with hemoptysis. So this is caused by a pulmonary trematode. This is caused by a pulmonary trematode, which is nothing but Paragonimus westermani. Paragonimus westermani. So how does man infection? Usually man acquires an infection by conception of crab. Okay, by conception of crab. Crab remains as the second host and snail remains as the first host. And patient usually presents with hemoptysis. So the drug of choice here is praziquantel. Drug of choice here is praziquantel. Next question. Identify the egg from the image given below. This is a very straightforward question. So you are able to see a clear eggshell and you are able to see 4 blastomeres. You are able to see 4 blastomeres. So this is nothing but hookworm infection. Nothing but hookworm infection. Very straightforward question. So hookworm mentioned here is Ankylostomata duodenum. How will the other egg look like? Trichomus, if you see, means it will have mucus plug on either side. Mucus plug on either side. Ascaris, if you see, means there are 3 types of egg. Fertilized, not fertilized, and decorticated egg. So 3 types of egg are seen. There you will not be seeing all these blastomeres. And entropius, if you see, means you will be having a plano-convex egg. You will be having a plano-convex egg like this. So a clear eggshell with 4 blastomeres point towards hookworm infection is a very direct question. Next question. A fungal infection of the mitral wall shows silver gomorrhea stain positivity. Okay. Which organism is most likely causing the infection? Okay. They have themselves told that gomorrhea methenamine stain is positive. So, if at all gomorrhea methenamine stain is positive means it will be black in color. So, in the image also you are able to see black color fungi. They're asking which is the most common organism. If at all you clearly see this image means you're able to see something like this. Fungi with acute angle branching. Acute angle branching. Okay. So this very well points towards aspergillosis caused by Aspergillus fumigatus. Okay. So Aspergillus infection will have acute angle branching. Will have acute angle branching. Mucor, if you see, means you will be able to appreciate broad aseptate hyphae. The hyphae will be very broad. Broad aseptate hyphae. There will not be any septa present. Histoplasma, if at all you see, means you will be having very tiny yeast cells and will be present within the macrophages. Candida albicans, again, you will be able to see yeast cells, 5 to 10 micrometers. So the question here is, you are able to see hyphae which is having acute angle branching which points towards Aspergillus infection. Next question. A culture of Streptococcus pneumoniae shows alpha hemolysis and Rossmann colonies on blood agar. Which test is most useful for its identification? Okay, so they themselves have told that it is Streptococcus pneumoniae. They themselves have told that it produces alpha hemolysis and Doddsman colony. Okay, so whenever you see this alpha hemolysis, there are only two organisms which produce alpha hemolysis. Okay, two organisms. One is Streptococcus pneumoniae and another is Streptococcus viridans. So these are the two organisms which shows alpha hemolysis. Streptococcus pneumoniae is the pathogen, whereas viridans will be commensal or a part of normal flora. So how to differentiate whether it is viridans or pneumonia is the question. Okay, first is this will be appearing in lanceolate shape and it will have a capsule if at all you see in microscopy. Next is you will be able to see Doddsman or carom coin appearance in blood agar. This is due to the presence of autolysin enzyme. Next, other biochemical test which helps in differentiating Streptococcus pneumoniae and Streptococcus viridans is bile solubility test. Streptococcus pneumoniae will be bile soluble. This is again due to the presence of autolysin. It is nothing but amidase enzyme. Another important antibiotic which helps in differentiating Streptococcus pneumoniae and Streptococcus viridans is optocin. Streptococcus pneumoniae will be optocin sensitive, whereas viridans will be optocin resistant. So this is how we differentiate Streptococcus pneumoniae and Streptococcus viridans. So the answer here is bile solubility test. Next question. Match the following parasites with the disease they cause. Okay. So the options given here is Strongyloides stercoralis, Ankylostoma brasiliensis, Toxocara canis, Cystostoma, and the corresponding option given there is larva currens, larva migrans, cutaneous larva migrans, and swimmer's itch. Very straightforward question. You know that Strongyloides and Ankylostoma enter the body through skin penetration and they cause cutaneous larva migrans. Strongyloides stercoralis, they have given a name called as larva currens. They travel at a speed of 10 centimeter per hour. So for option A, it is 1. Ankylostoma brasiliensis also enters the skin through penetration. They also cause cutaneous larva migrans. So B to 3. Toxocara canis, this is known to cause visceral leishmaniasis. C to 2. Next is the cystosoma. Cystosoma again it enters the body through penetration, and here the causative agent is the sarcarial larva, and it causes sarcarial itch. Okay, which is otherwise called as swimmer's itch. So it is D for 4. Okay, so this is the answer. Next question. A patient presents with multiple draining sinuses releasing black granules. Which of the following organism is most likely responsible? Okay, so we're having the patient is having sinus granules, and they are mentioned it is black in color. Obviously, patient would have swelling also. So this points towards patient is having mycetoma. So they're asking what is the commonest agent? Okay. Streptococcus aureus, they can also produce a similar condition called as botuliomycosis, but it will not produce black granules. So this option is ruled out. You're left out with Nocardia, actinomyces, and Madrella mycetomatis. All these agents can cause mycetoma, but Nocardia and actinomyces are known to produce white to yellow granules. White to yellow granules. So the correct answer here would be Madrella mycetomatis. Okay. So Madrella mycetomatis is known to produce black colored granules. Next question. Which of the following is true regarding the virus in the image? So if you see the image means it's a very simple question. First of all, you have to see the image. If at all you see the image means you're able to see some skin layer, corneum, granulosum, spinosum. You're able to see the skin layer and you're able to see the infection is mainly limited to the squamous epithelium. Okay, mainly limited to the squamous epithelium. And you're able to see here early genes and late genes. Early genes E1 to E7 and late genes. Okay, late genes. So it's a very easy question to answer. So this is nothing but human papilloma virus, which has a strong tropism towards the squamous epithelium. Okay, so HPV, which of the following is correct? Now we have identified what is the agent. Now you have to tell which is the correct answer. So HPV, this is a DNA virus, not an RNA virus. Yes, it is an oncogenic virus. It produces a lot of malignancy like cervical malignancy, head and neck tumors, a lot of malignancy. So the correct answer would be oncogenic virus. Vaccine is not available. No vaccines are available. And the manifestation is not painful genital ulcer. It produces warts, epithelial lesions, and it is not painful genital ulcer. So the answer is oncogenic virus. Moving to the next question, Mycobacterium tuberculosis is handled in which laboratory level? BSL laboratory. Very straightforward question. We all know this Mycobacterium tuberculosis produces lots of aerosol. Very straightforward question. It should be handled in BSL 3. Next question. A healthcare worker was vaccinated with 6 scheduled doses of hepatitis B but tested non-responsive after 3 months. What should be done now? 6 schedule means usually how many doses should be given for hepatitis B vaccine? Ideally 3 doses. 0, 1 and 6 months. What they have mentioned is they have given 6 doses, which means 2 series of vaccination is completed. And still after that, he is non-responsive. So going to this table, how to give the correct answer. If at all you're completely vaccinated and your titers are protective, means even if you get a prick from a positive patient or a negative patient, you needn't do anything. Nothing is necessary. No intervention is necessary. Once protective, you are considered lifelong protective. Once protective means lifelong protective. No need to do anything. No need to worry at all. Consider you're vaccinated, but your titer is less than 10. You're not protective and you have got a prick from HBsAg positive patient. In such case, you have to take immunoglobulin immediately or within 7 days, and you have to restart your second series of vaccination. Okay, your second series of vaccination. If at all you have got prick from a patient who is HBsAg negative, then no need to start with immunoglobulins. Right away, you have to restart your vaccination. Okay. Next, you have been vaccinated, but you have been partially vaccinated and you have got a prick from a positive patient. In such case, also you have to take immunoglobulin, and again you have to restart from where you left. Okay. For example, you have taken the first dose, 0 dose you have taken. First month you have completed, you have skipped the last dose means you have to take the last dose alone. You need to restart the vaccination. Start from where you left. Start from where you left. No need to restart the vaccination. Whichever dose you have missed, that dose alone you have to take. Again, similarly, you have got a prick from a patient who is HBsAg negative. No need to take immunoglobulin. But again, you have to start from where you left. Whichever dose you will complete, take that vaccination alone. Okay. Next, this question. This is a question which they have asked in INI-CET. Non-responder, that is after 2 complete series of vaccination, that is they have taken 26 doses, still their titers are less than 10. In such condition, if at all you have got prick from a HBsAg positive patient, you have to take immunoglobulin 2 doses, 1 month apart. Okay. And if If at all it is a negative, you have got a prick from a negative patient, means no need to do anything, no intervention is necessary. Okay. So the answer here would be you have to take hepatitis immunoglobulin. So moving to the next question, which of the following statements regarding diphtheria toxin is not true? So the option given are vaccine is available. Yes, vaccine is available. It causes myocarditis. Yes. How's the initial manifestation is diphtheria usually presents with pseudomembrane formation and bull-like appearance. If at all the pseudomembrane extends, it causes asphyxia, and a complication would be myocarditis, and CNS manifestation also can happen. So these are all the complications of diphtheria. Yes, myocarditis can happen. Yeah, it is an exotoxin. Diphtheria toxin is an exotoxin which acts by inhibition of elongation factor 2. So this is also correct option. Next is it is the most harmful toxin on earth. No. Here it is not the most powerful toxin. The most powerful toxin will be botulinum toxin. So this is the wrong answer. Okay. Moving to the next question. Image depicting fruit bat Steropus species along the life cycle of Nipah virus is shown. Okay, so you're able to see bat. Okay, you're able to see human. You're able to see pig. So it is a life cycle of Nipah virus. Which of the following statement regarding Nipah virus is correct? Okay. So Nipah outbreaks have been seen in Kerala and all. It doesn't cause 100% fatality, 80 to 90%. And as seen in the figure, fruit bat acts as the natural reservoir. Yes, this is the correct answer. It is not a DNA virus. It is an RNA virus belonging to paramyxovirus. It's not to Rhabdoviridea family, and it is not transmitted by mosquito bites. It is transmitted by bats or in close contact with pigs or in close contact with infected human. Okay, so the correct answer would be fruit bat serves as a natural reservoir. Next question, which of the following is an obligate intracellular organism? Again, this is a very straightforward question. So the option given here are Ehrlichia chefensis, Staphylococcus aureus, Tophilima, and Staphylococcus pyogenes. Obligate intracellular organism is Ehrlichia. Others can also be present as intracellular organism, but they are not obligate. They are not present always inside. Other than Ehrlichia, other organisms are Chlamydia, Rickettsia, Anaplasma. These are other organisms which are obligate intracellular organisms. So the answer would be Ehrlichia. Next question. When Ucheria bankruptcy are absent from the peripheral blood, where they are most likely to be found. And the options here are liver, lung, spleen, and skeletal muscle. If at all in the option they have mentioned as lymph node, means the correct option would have been more appropriate option would have been lymph node. But here they have mentioned as liver, lung, spleen, and skeletal muscle. We all know that during the life cycle, microfilaria, they get trapped or they escape from the peripheral blood and they go to lung and they cause allergic reaction. Allergic reaction causing tropical pulmonary eosinophilia. Tropical pulmonary eosinophilia or Weingarten syndrome. Okay. So the option here is lung. Next question. Colposcopy image is given. What is the most likely diagnosis? So if at all you see this image, means you're able to see a cervix which is having lots of dots resembling strawberry. Okay. Resembling strawberry. So strawberry cervix or colpitis macularis is seen in trichomoniasis caused by Trichomonas vaginalis. Okay. So classical strawberry appearance of cervix or colpitis macularis is seen in Trichomonas vaginalis. So thank you. I hope the question paper microbiology part was simple to moderate. All of you did well. Thank you so much.